Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. And if you are listening to this show, you may not need the help of our guests, but maybe you know someone that does. The topic is all about hearing health. My guest today is Dr. Esther Fogel, a doctor of audiology at Comprehensive Audiology, located in Lynbrook. Dr. Fogel, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you, Jeanine, for hosting me today.
So first of all, I hope you're doing okay in light of the pandemic. Has the virus affected you personally?
Thank God my family's healthy. Everybody's healthy at home, but we definitely had a nice, long experience here at the office. I
can imagine. How do you handle patients there in your office in light of the pandemic?
Sure, that's a good question. So to preface that, I'm going to say that many of my patients have hearing loss, and they were particularly affected during this pandemic. Individuals with hearing loss do much better with face-to-face conversation, face-to-face social interactions. And it was very difficult for many people that they were not able to get together with family and friends. They may have had difficulty hearing over the phone, difficulty once people started going out and having to converse with people wearing masks, or people with hearing loss that rely a lot on lip reading. That became very difficult. So here at our office at Comprehensive Audiology, we really tried our best to keep in touch with our patients throughout the pandemic, throughout all the stages. From the beginning, when we had to physically shut our doors for about 2 months before we reopened, we were still answering phones, answering emails. We were mailing people letters, emailing them, keeping in contact. If anybody needed help with their hearing devices, we were having them do drop-offs. We were shipping supplies. We had some virtual appointments. We tried our best to keep in touch with all of our patients, and they were very grateful for that. And then when we reopened, we, of course, kept to all the safety protocols recommended by the CDC in terms of keeping patients, one patient at a time in the office, having proper sanitary measures, everyone wearing masks and gloves and all that. And still till today, we keep up with those protocols.
So what is a doctor of audiology? Describe your scope of practice.
So an audiologist, we deal with any issues relating to hearing and or balance. We start with the diagnosis. So we diagnose, we evaluate any issues with hearing, with tinnitus, ringing in the ears, and balance. And then we provide any treatment plan for each person individually, any hearing devices that they may need if they do have hearing loss. We also have hearing prevention measures. So we focus a lot on hearing conservation and protecting one's hearing. So even for those individuals that don't have hearing loss, but they may be at risk for noise-induced hearing loss from noise exposure from their profession, if they're a musician, a dentist, they work in contracting, any industry that has loud noise, we provide any type of custom hearing protection, and we focus a lot on protecting your hearing as well.
So tell me, what brought you to audiology? What is your background?
So my background is actually first in the field of speech-language pathology. So I always knew I wanted to be in the medical profession, working with people. I started off doing speech-language pathology. That was my first degree. And through that, I was exposed to individuals with hearing loss at working as a speech-language pathologist. And I found that to be very interesting and rewarding to help people who cannot hear, to help them hear and communicate again. And that led me to to, I don't want to say switch fields, but to transition over more towards the audiology aspect of helping individuals with hearing loss to communicate and reconnect back to their world again.
So what does your patient population look like? Is it more the older adult, or do you see patients across the lifespan?
Sure. So we see patients of all ages in my practice across the lifespan, from infants, as young as infants, and through young adulthood, older adulthood, and I have patients over 100 years old. So we really see across the lifespan. Hearing loss is not only age related, although some people, that's what people out there may think. Yes, it is more common as we age. However, there are a lot of young adults and children who have hearing loss for various reasons, whether from a medical issue, whether it's congenital, whether they've been exposed, as I mentioned before, to noise or any other condition. It can happen at any age. So whatever age you are out there, if you are experiencing any question about your hearing, any difficulty with your hearing, it's never too young to come in for an evaluation.
So tell me, what causes hearing loss? I know sometimes I ride down the street and I hear loud music and I wonder, wow, that person is not going to be able to hear in the next couple of years because of that loud booming music is going to destroy probably their ability to hear. Does that cause hearing loss? And tell me some other things that might.
Yes. So as we mentioned before, exposure to loud noises, it can be from music or any other loud noise equipment, is one possibility of a cause of hearing loss. And interestingly, that is one of the causes that can be prevented. So many of the other causes cannot be prevented. But if you have any exposure to loud noise recreationally or at work professionally, take those measures, take those steps to protect your hearing, because that is one thing that can be prevented. That being said, there are many other causes or risk factors for hearing loss. As I mentioned, some types of hearing loss can be congenital or genetic. A person can be born with a hearing loss for various reasons. They can develop hearing loss in childhood, also from genetic issues. There are some medical conditions that pose a risk for hearing loss. Hearing, like any other part of the body, relies on good health and good blood flow. So people with heart conditions or diabetes may be at risk for hearing loss. There are something called the sudden sensory neural hearing loss. Sometimes people can be exposed to any type of virus or anything like that can cause a sudden hearing loss. That's something now with COVID that we're just researching, how some people may have developed hearing loss and tinnitus from that virus, like other viruses. There are also certain medications that can cause hearing loss, certain medications that might be life-saving for other things, such as some chemotherapy drugs or cancer drugs, or certain very strong antibiotics that might be life-saving for a person, but may have side effects of hearing loss. So there is no one cause of hearing loss. There can be many causes.
How often should I do you recommend a person getting their hearing checked?
Okay, so that depends on a person's age. So for children, all newborns should have a newborn hearing screening in the hospital before they are discharged. So if for whatever reason that baby did not pass the newborn hearing screening, they should be followed up right away. But throughout childhood, if there's any concerns in school for educational difficulties or speech and language difficulties, a hearing evaluation should be part of that evaluation to rule out hearing loss as a contributing factors to any of those educational issues. As an adult, again, it's really very different depending on whether you feel you may have hearing loss. Like I mentioned before, a person can have hearing loss at any age. So if you have concerns, you should go for an evaluation right away. Otherwise, if your profession has noise exposure, you should definitely at some point go for a baseline hearing test. And if you have no concerns, then I would say at about age 50, every person over 50 should have at least one baseline hearing test and then take it from there.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're talking about hearing health with my guest, Dr. Esther Fogel, a doctor of audiology at the Comprehensive Audiology located in Lynbrook. So, Dr. Fogel, could you tell me the hearing check? Is it an invasive process?
It is not invasive. There is nothing painful about it. It involves firstly taking just a history, getting to know each individual and what their concerns are about their hearing or communication. And then most of the hearing evaluation is performed in a soundproof test booth. We put headphones on, we run different types of testing, and then we take different measurements of the ear, some physical measurements. We just put a probe tip next to the ear. Nothing is invasive.
Is hearing loss genetic?
It can be. It can be genetic or passed down amongst family members, yes. So if you have family history of hearing loss, just like any other medical conditions, if you have that in your family, that's definitely more of a reason to have your hearing checked.
So when it is a hearing loss, what are some of the signs and symptoms that a person is losing their hearing?
That is a very good question because many times people don't realize right away that they are experiencing hearing loss. Sometimes it takes up to the point where others may tell them that they have a hearing loss, like their family members or friends. If there can be a range of symptoms, it can start off as simple as having difficulty hearing when there's background noise. So if you're in a group of people and there's other ambient noises and you're having a hard time following a conversation. It can be that you're having a hard time hearing people who are soft-spoken or who are whispering, or maybe from standing a distance away, hearing young children, hearing people with high-pitched voices. So any of that, if you feel like other people are mumbling, you think that other people are mumbling or maybe talking fast and you can't hear them, that could also be that you have hearing loss, so it's worth it checking that out. Some people experience hearing loss as a sensation. They may feel like their ears are clogged or they are blocked and they're not sure if their ears are congested. They may feel like they have wax in their ears, but they really don't. It's just a hearing loss. So any sensations like that warrants a hearing test. One of the other symptoms is ringing in the ears, something that we call tinnitus. That's usually a side effect of hearing loss. So if you're starting to have ringing in your ears or you're starting to feel a little bit of vertigo or dizziness, that may also be first stages of hearing loss.
When a person is in, I don't know, have you ever experienced a person being in denial that they're losing their hearing?
Yes, I experience that all the time. And so actually it is well known that from the time a person actually starts to have hearing loss till they first go into a doctor or an audiologist to be checked is on average 7 years from the time they actually started having some hearing loss. So one of my goals is to try to shorten that time and to try to get rid of the stigma that's associated with hearing loss. Because as I mentioned before, hearing loss can happen across all ages. And so even if you're young, it's time to get checked if you're having difficulty. And when you ask about people being in denial, there are many reasons, as I'm sure you're aware, that people avoid going to have their hearing checked. There could be, reasons they don't want to deal with it for various reasons. Maybe they think it's, like I said, that they're getting old. They don't want to admit that they're having trouble hearing. So many different factors. But we address each concern that a person has. I try to understand why a person is hesitant, why they're in denial, why they don't want to address it. And we work with each person individually to address those issues.
Could hearing losses also affect your balance as well as your speech?
Yeah, the balance system, part of our balance system is in our inner ear. The way we keep our balance is through various body systems. One is vision, to see where you are in space. The other one is what we call proprioception, to feel where you are in space, whether you feel your feet standing on the ground or being lifted up or turning sideways. And the third body system is the inner ear. So the inner ear, in addition to the hearing organ, which is called the cochlea, there is also the balance organs called the semicircular canals. And those are involved in balance. And if there is any issue to the ear, it can affect a person's hearing and can possibly affect their balance as well. And that can have a person feeling imbalanced. They can have spinning or vertigo, and so they can be related.
So I know you spoke about the ear exam. So if a person comes into your hospital or clinic or healthcare facility and is experiencing balance disturbances, what other diagnostic tests may they expect?
In my practice, this is not a hospital setting. My practice is a small private practice. And I personally do not have the balance equipment here. If a person is experiencing balance issues, then I would refer them out to another audiology center or ear, nose, and throat physician. And there are other diagnostic tests that are done for balance. There's an ENG, there's a rotary chair, there's different tests where they have you look at different things. They tilt you to different sides and to try to imitate the spinning and the vertigo and to evaluate where it's coming from in the ear or other parts of the body.
So is this a costly process when it comes down to examining my ear, or does insurance cover it?
Insurance does cover the diagnostic evaluation for hearing. And we do here in my office accept many major insurances. Obviously, each individual would have to check with their insurance, but this is something that is covered by insurance, yes.
So let's discuss how do we intervene, probably prevention. When I'm wearing a headset or ear pods or those things that I put in my ear over my ears to hear music, what is an appropriate volume that I should set in my device?
There is a very specific limit in terms of volume, or what we call decibel level, and that is 85 decibels. Anything at 85 decibels and above can be dangerous to your ear, can cause permanent hearing loss. And it also is a matter of how long you listen to that sound. So how loud and how long. So a sound like 85 decibels, maybe after listening for a few hours, can cause hearing loss. Whereas if you jump up to 105 or 110 decibels, that can cause permanent damage instantaneously within 1 minute. Wow. Something like a gunshot or a firecracker, or if that's near your ear, that can be, above 110, 120 decibels. So you have to take into account the volume as well as how many hours. So just from day to day, like you asked about headphones or AirPods, you want to make sure that you're not making the volume too loud. Most devices nowadays have some sort of warning sign. It'll turn orange or turn red and warn you that you're getting loud. So try not to go above that level. And also give your ears a break. So don't listen, 4 or 5 hours at a time. Give yourself a break every half hour, every hour. Give your ears a break to rest between listening.
That's great to know. You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're talking about hearing health with my guest, Dr. Esther Fogel, a doctor of audiology at Comprehensive Audiology located in Lynbrook. So talk to me now about hearing aids. I know that they've gotten quite good at this. They're very small and they're very inconspicuous. How do they work? Where do I get them from? And who are the people that need them?
Anybody with any degree of hearing loss can be eligible or can be a candidate for a hearing aid. So the first step would be, as we mentioned earlier, to have a full hearing evaluation. And as you mentioned, the hearing aids have become very sophisticated, and there are many types of hearing aids out there. There are smaller ones, larger ones, in the ear, behind the ear, custom made. A lot of them can now be rechargeable. A lot of them have Bluetooth capabilities where you can pair them to many devices and stream phone calls, stream music into your hearing aids. But the most important thing is that you are fitted appropriately with the hearing aids I would recommend by a doctor of audiology, because it requires the evaluation, and they need to be prescribed for your hearing loss, for your needs. Every person is different. Every person is different in the shape of their ear and in terms of their lifestyle needs. It's not a one size fits all. It's not something that I recommend just ordering online or buying over the counter. It's something that you should be seen by a doctor. And most audiologists, like myself, we do the evaluation, and we also can fit you with the hearing aids, custom made to your ears, to your hearing levels.
And what is the price point? Is it covered by insurance?
So there is a wide range of pricing of hearing aids, and I won't get into all the details here over live radio, but I can tell you that there are some insurances that do cover hearing aids and some that do not. So that would be part of something that we can check into for our patients. We can check the benefits of your insurance and determine if there is coverage and how much.
So if I have hearing loss in one ear, do I just wear the hearing device in that one affected ear, or do I still need hearing aids on both ears if I have loss in one?
So that is a very good question. And before I answer that question, I want to give you just a little background about why it's important for us to hear with two ears and not just with one ear. And a good example might be from vision. So when a person can see, if a person wants to be able to see in 3D, or if they want to be able to have peripheral vision, they need two eyes. If you only were looking with one eye, there would be no depth perception or anything like that. So very similar with the ears, we need two ears in order to hear all the surround sounds around us. So the brain, we really hear with our brain, not necessarily with our ears. The sound comes into the ears, and then our brain processes what we want to hear to understand what we're hearing. In order for us to determine, for example, which direction a sound is coming from, is it coming from the right, is it coming from the left, and we can pinpoint that to an exact angle, our brain needs to receive that input from both ears. Another very important thing in real life is that most of the time we're in situations where there's other noises around us, surround sounds, background sounds, a car passing by, music. If you're at a restaurant, there's a lot of noise going on. And we need the two ears in order for our brain to be able to separate one sound from the other and focus on what we want to hear. So in most cases, most commonly people who have hearing loss have it in both ears. And if it's equal in both ears, we always recommend two hearing aids for that reason, so that we can get all the sounds that we need and hear them clearly. If there are very specific cases, as you asked about, having hearing loss in just one ear, sometimes we may fit just the one ear. Again, each case needs to be evaluated individually to see exactly what's going on in each ear.
I've seen on the market a device that you put in the ear to remove wax from the ear. What are your thoughts about that?
I would follow the instructions on the label. Make sure that it's something that is FDA approved before you try it at home. However, as in any case, I always recommend best is to see a doctor. There are some audiologists out there that can remove wax, or you can go to an ear, nose, and throat doctor, or many primary cares may do that.
What are your thoughts about Q-tips in the ear to clean them?
The ear is meant to have some wax. The wax is there for a reason. It protects the ear from bacteria and foreign objects. That being said, a lot of people don't like the feeling of having it in there, or there are some people who build up too much wax and it does have to be removed. The recommendation is really not to use the Q-tips because you can injure yourself if you go too deep. You can poke the ear canal, you can poke the eardrum. So I would say use a washcloth or anything that's not too small to put in nothing smaller than your pinky finger should go into your ears.
So it's really, the whole notion is to clean the outer ear more than the inner.
Correct. And if a person does build up wax deep, in the ear, that should be professionally cleaned out.
So what's unique about your office? Talk about your practice.
My office, as I mentioned earlier, is a small, privately owned practice. I'm the sole audiologist here with some staff members here in my front office. We pride ourselves on providing personalized care and attention to each of our patients. So when you come in here, we will know your name. We will know who you are. We try to find out as much about your hearing and communication needs so that we can find a solution that is appropriate both for your hearing levels as well as for your lifestyle and your needs in terms of communicating with your family, friends, at work, or anything like that.
Do you have an email or a phone number you can provide for us?
Of course. We have the office phone number, which is 516-387-4000. We also have a website, which is comprehensiveaudiology.com. You can learn about our practice on the website. You can also schedule an appointment through our online scheduling system. You can also always email us at info@comprehensiveaudiology.com. One of the other things that I want to mention about our practice is, in addition to providing the personalized care, we have all the state-of-the-art equipment here. We have all the newest diagnostic equipment. We also have a brand new piece of equipment, which is a 3D digital ear scanner. So when we make custom hearing aids or custom hearing protection, we no longer have to take a physical impression with silicone that we squirt into the ear. That is, right now we have a new piece of equipment. It's the company called the Au.D scan. It's a 3D, like I mentioned, 3D digital scanner of the ear where we can get a 3D image of the ear and use that to order any types of hearing devices, hearing protection for our patients.
Thank you for being here, Dr. Esther Fogel, a doctor of audiology at Comprehensive Audiology, located in Lynbrook. We hope you stay safe and continue to stay healthy, and thank you for being our guest today.
Thank you so much for hosting me today.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.